Welcome, Professor, classmates, and anyone else that's joining us for this presentation today. We are going to be exploring a remarkable chapter in the U.S. history, the Tuskegee study of syphilis. We are going to use this particular study as a framework to help us discuss ethics, healthcare law, culture competency, as well as best practices in regard to patient care and research. My name is Cynthia Adams, and just hang on for the ride. So a little bit about the Tuskegee study. It was started in 1932 and ended around the year 1972. They studied 600 African American men in Alabama, 399 of which had syphilis. 201 of them did not have syphilis. Under the pretense of getting free healthcare and treatment, the study sought to track the outcome of untreated syphilis in African American males. And although penicillin became widely available in the 1940s, the participants in this study were never given access to this life-saving medication. A lot of these participants thought that they just had what was known as quote-unquote bad blood, and they thought that they were receiving treatment, but they never actually had any type of treatment. On this next slide, we're talking about ethical and legal issues. This study was an absolute failure in the terms of ethics. There was absolutely no informed consent from any of the participants for this study. And for decades, these participants were misled. Not only were there no consents, but their actual diagnosis was also kept from them and treatments were withheld. Not only are these gross transgressions of legality, but there are also ethical standards that should be in place to protect human participants that were not done. Informed consent is essential in modern healthcare and research. It must always include risk, benefits, voluntary participation, and alternatives. The cornerstone of ethical healthcare and research is informed consent. Patients should always be aware and willing with their health. The Tuskegee study represents the inherent dangers of bypassing the principle of informed consent. And during the study, no consents were ever signed by any of the participants of the study. In this study, privacy was not respected, and confidentiality wasn't just overlooked, it was exploited. Not only that the men that participated in this study had their health status used against them. This study misused the health data of the participants. They had no safeguarding for any privacy for these people. And they also breached the trust between the medical professionals and the community. Medical mistrust is still influenced by the Tuskegee study to this day. The overwhelming reluctance of African Americans toward medical facilities and healthcare in general stems from historical trauma that is very real. This Tuskegee study had a huge impact on society. It helped to heighten the mistrust in the healthcare system among not only African Americans, but for underprivileged communities. And it caused historical trauma and hesitancy towards medical research as well. Due to the heinous violations by the Tuskegee study, many major reforms were introduced, including the National Research Act, which was started in 1974, the Belmont Report, which was started in 1979. Institutional review boards were created to oversee research studies and to ensure ethical treatment of human participants. Hopefully, these steps will help to prevent future tragedies. Some legal and ethical principles that are now in place, which include HIPAA, which protects patients' privacy, the Belmont Report principles, which are respect for persons, benefits, and justice. These principles stress informed consent, fair treatment to all, and help to minimize harm. They are essential and are the ethical backbone of clinical research today. Being culturally competent helps us to treat patients with respect, especially those from underrepresented groups who might have legitimate concerns about healthcare systems. As a healthcare provider, we have an utmost duty to learn and understand diverse perspectives, to build trust in underserved communities, and also to recognize and correct any implicit bias that we may have as a healthcare professional. Making morally and culturally aware decisions every day is of utmost importance to help prevent a Tuskegee repeat, if not just about policy and procedure, but also about how we interact with our patients every single day. Some recommendations for the healthcare professionals would be to prioritize your transparency and communication with your patients. Always try to maintain patient autonomy. Continue training in cultural competency and ethics continually, not just a one-time deal. And also to help engage communities in care decisions. Now I have a question for you guys. How would you, if faced with a study like Tuskegee, how would you have acted differently as a healthcare professional? This reflection will help you to retain more of the lesson and to think critically on the information you have learned. It helps you to engage with history and consider how personal and professional ethics guide decisions. And I'll give you guys just a moment to think about that question. See what your thoughts might be on it. So some key takeaways. Let's just reflect on what we learned today. And by doing so, we can reflect on the past while also equipping ourselves to provide better, more ethical care to our patients, not only today, but in the future. Those key takeaways would be the Tuskegee study is a reminder for all of us of the harm unethical practices can cause, that we must always uphold integrity, respect, and justice in all of our patient interactions, each and every single time we interact with our patients, not just some of the time. We can also all agree that cultural competency and ethics are an ongoing responsibility, not just a one-time online course when you first started a place, but continually ongoing. The last slide just shows my references. Let's give a big thanks to all of the information I was able to gather from these reputable sources, and to all of you that stuck through this and listened to my presentation over the Tuskegee syphilis study that was conducted in Alabama. Hope y'all all have a good day. Thank you. Bye.